Working with Veterans, Part 1, Introduction. In the remaining modules of the course, we'll cover the topic of how trauma impacts veterans and what this means for trauma-informed care. In this module, we'll explore why people join the armed forces and the prevalence of trauma among veterans. First, we'll look at some facts and figures relating to veterans in the UK to help us better understand this demographic. A veteran is someone who has previously served in the armed forces but has now left. There are roughly 2.4 million veterans in the UK, and an estimated 15,000 people leave the armed forces each year. You're considered a veteran if you've served at least one day in the armed forces. This means there are veterans of all ages across the UK. The overwhelming majority of veterans are male and Caucasian. There are many different reasons why people join the armed forces. In terms of a career, there are financial benefits including subsidised food and accommodation and a free pension. And the armed forces also opens up a variety of career paths through training and qualifications gained during service. Recruitment campaigns for the armed forces promise individuals the opportunity to develop and become a better version of themselves. There are also emotional and cultural reasons behind joining the armed forces. An individual may come from a family with a history of service, so may feel a sense of pressure or obligation to join. Many roles require no formal qualifications, lowering the barriers for entry. The armed forces provides recruits with a sense of family and belonging that they may not have experienced before. And it offers a means of escape for those trapped in abusive or harmful environments. We can see how the armed forces might appeal to people who have had difficult upbringings. Studies show that previous experience of childhood trauma is more commonplace in individuals who join the military. Let's quickly revisit Richard's experiences from earlier in the course. Take some time to reflect on why Richard may have wanted to join the army based on his experiences as a child. The armed forces would have offered Richard a sense of belonging, camaraderie, and a means of escape from his abusive home life. For some veterans, trauma is a result of their early life experiences, but for many others, trauma is a direct result of their time in the armed forces. This can come about from both their experiences in the armed forces and the challenges veterans face when leaving the armed forces. This timeline shows the key events in a typical lifetime. Each life event from the time you enter the armed forces is affected by your experiences in the armed forces. A veteran can be exposed to different types of trauma during their time in the armed forces, no matter how long they serve for. These traumas can arise from exposure to traumatic experiences during service. They can be affected by job satisfaction and fulfillment based on how long the veteran served for. And they can also occur as a result of detachment from civilian life when re-entering society as a veteran. In the following animation, we'll introduce 4 siblings with different experiences of the armed forces, who we'll revisit in the next module. In this animation, we'll explore the different experiences veterans can have when serving in the armed forces by looking at the experiences of 3 brothers. Michael, Simon and William are all brothers of a similar age. They experienced a similar childhood, had a loving mother and father, and only experienced little T traumas as children, such as the death of their grandparents. The first brother, Michael, joined the RAF. He successfully completed his training, but shortly after joining his unit, Michael sustained an injury and had to be medically discharged. The second brother, Simon, joined the army. He successfully completed his training, entered a unit, and spent 10 years in the armed forces. During this time, Simon went on 3 tours and won medals. The third brother, William, joined the Navy. He served a full 22 years and reached the armed forces retirement age. During his time in the Navy, William was involved in 12 tours and reached a senior rank. Despite having a similar upbringing, the 3 brothers that joined the armed forces each had very different experiences. We'll revisit these brothers in the following modules to explore the impact of their experiences during their time in, and when leaving, the armed forces. In this module, we've looked at the different motivations behind joining the armed forces, the prevalence of childhood trauma in veterans, and the different experiences veterans can have when serving in the armed forces. This background will help us understand trauma in veterans and the implications for clinical practice.